In recent years, a quiet yet profound shift has been taking place in the field of palliative care, the exploration of psychedelics, not to cure disease, but to transform how people experience the end of life. Substances like psilocybin, derived from psychedelic mushrooms, are no longer viewed solely as fringe or recreational compounds. Instead, they are being seriously studied for their capacity to ease emotional suffering, reduce existential distress, and help terminally ill patients reconnect with meaning, presence, and peace. The central question is no longer just about how long someone can live, but how well they can live, especially in their final chapter. For many facing life-threatening illnesses, the most difficult challenges are not physical pain alone, but the psychological toll of dying, grief, fear, depression, and a deep sense of disconnection. Traditional treatments often fall short when it comes to addressing these emotional and spiritual dimensions of end-of-life care. That's where psychedelics like psilocybin are beginning to offer something radically different: the possibility of profound psychological healing, even in the face of terminal illness. Clinical studies at institutions like Johns Hopkins and NYU have shown that a single guided psilocybin session can produce significant, lasting reductions in depression, anxiety, and existential despair among cancer patients. Many describe their experience as among the most meaningful of their lives, an encounter that helps them reframe death not as something terrifying, but as a natural part of the human experience. Some report a renewed appreciation for life, a deeper connection to loved ones, and a sense of emotional resolution that traditional therapies rarely achieve. These outcomes are not just psychological in nature, they ripple through the entire physiology of the patient. Reduced stress and emotional distress are known to impact inflammation, immune function, and even the body's perception of pain. Patients who are less anxious tend to sleep better, eat more, engage more with others, and require less medication. In this sense, psilocybin isn't just making the final months or weeks more emotionally rich, it's also improving quality of life in a tangible, biological way. The conversation is beginning to expand from strictly palliative applications to broader questions of aging and longevity. Could psychedelics have a role not only in making death easier, but in helping people live more vibrantly at any age? There is early speculation that by reducing chronic stress, enhancing neuroplasticity, and improving emotional regulation, compounds like psilocybin might support not only mental wellness but also physiological resilience, potentially extending health span, if not lifespan. However, in palliative care, the focus is not on buying more time, it's on improving the time that remains. This reframing is critical. It acknowledges that longevity without quality can feel hollow, and that suffering, even amid advanced medical care, remains one of the greatest challenges for patients and families alike. Psychedelics, when used responsibly in a therapeutic context, appear to give patients agency over their inner life in a moment when everything else, body, future, control, is slipping away. That is a form of healing that modern medicine, for all its progress, has rarely been able to provide. The integration of psychedelics into palliative care also challenges us to rethink what it means to treat a patient. It suggests that well-being is not only about curing disease, but about cultivating acceptance, emotional peace, and spiritual insight. These experiences may not extend years in the conventional sense, but they can transform a moment, a relationship, or a final goodbye into something sacred. In this light, psilocybin and other psychedelic therapies don't compete with traditional longevity science. They complement it, reminding us that the measure of life is not just its length, but its depth. As regulatory landscapes evolve and stigma fades, the potential for psychedelics in end-of-life care is becoming less hypothetical and more actionable. With careful oversight, therapeutic preparation, and ethical frameworks in place, these compounds could help redefine modern palliative care, not by extending the road, but by illuminating it. Because sometimes, the most meaningful medicine isn't about adding more days, but about filling the days we have left with clarity, connection, and peace.